I'm Dr. Vijay Yeldandi, Chief of Infectious Diseases at Continental Hospitals and a Professor of Medicine at the University of Illinois at Chicago. So winter has set in and it has now become quite chilly. This is time for us to think about how this cold weather impacts on all sorts of respiratory illnesses who have had cold, cough, runny nose, and so on and so forth. A lot of these have turned out to be influenza or other respiratory viruses like parainfluenza, etc. But of late, we have seen now once again an increase in the number of COVID infections. So it becomes important for us to think about what we can do to reduce the risk of getting these infections and also trying to stay as healthy as possible. Firstly, since all of these respiratory viruses, particularly COVID, are spread through the air, adequate ventilation is of utmost importance. So if you have a large number of people cramped together in a small space with poor ventilation, the viruses are going to spread rapidly. To a certain extent, you can reduce the risk by using masks. And during this time of COVID, I would strongly recommend that you use a mask. A regular surgical mask would be adequate. It's only for healthcare professionals who are taking care of patients with COVID that we recommend an N95 mask. The other thing that would help in improving the resistance of your body or improving your immunity and your ability to tide over these infections or prevent these infections is keeping your immune system in good shape. So how do you do that? Good nutrition, adequate sleep, and some exercise. These are the best way to have good immunity and an ability to ward off these infections. The other most important thing is vaccine. If you have not received your influenza vaccine, you should. If you have never taken the COVID vaccine, you should. And if you have not received COVID vaccine for more than a year, it probably is a good idea for you to discuss COVID vaccine with your doctor. Vaccines are extremely effective at preventing these infections. And even where people do get infections after being vaccinated, and unfortunately some people do, the infection and the illness is much milder. In cases where there is a specific viral infection like influenza and it is early in the illness, perhaps an antiviral agent like oseltamivir might help. For some people with COVID early on, it may help to have an antiviral used. But otherwise, what needs to be done is simply rest and take adequate nutrition, get good sleep, and be safe throughout this winter.